let me know when we're live. So this is a continuation of Senate Appropriations, and we are taking budget adjustment testimony from the Agency of Human Services, and we have the secretary here and the CFO, and I don't see Tracy.
Tracy is not with us today.
Okay.
But you get rich or Tracy, you don't get both.
Oh, pardon me. Okay, all right. And Sheila Livingston is here for backup. So why don't you come up and take the seat, and we will go through your budget adjustment for the agency. I'm working this document, if that's your plan. So if you just put yourself on record and we'll get started.
For the record, I'm Jenny Simmons, I'm the Secretary for the Agency of Human Services, and I've brought my colleague Rich Donahue, who is the CFO for the agency. Rich?
Good afternoon, everyone. Rich Donahue for the record.
Shall we start with your big picture?
For many of you, we did a brief kind of overview of the agency not that long ago, but from the big picture, as passed in fiscal year 23, the agency's budget was $4.7 billion across all fund sources, or $1.1 billion in general funds. We are the largest agency in state government with a little over 3,700 employees across 6 departments, including the Agency of Aging and Independent Living, the Department for Aging and Independent Living, Children's and Families, Corrections, the Public Health Department, Vermont Health Access, which administers much of our Medicaid medical programs, and our mental health department. Moving forward, just to walk through this, and BAA, I know you just received yesterday the bill as passed from the House. We are
Hasn't passed. They just took it. They haven't voted. The House hasn't. It came out of committee though.
They voted it out of committee, excuse me. We haven't had an opportunity to fully vet that yet, so I just want to be clear about that as we move forward. And I also know that you've already heard from many of our departments, so I appreciate that some of this may be duplication for you. Across our major fund sources that we are requesting in BAA, we have the Transitional Housing Program for Complex Case Management across departments. This is a $2 million general fund ask. What this is for our departments who are in Dale, the Vermont Chronic Care Initiative, and economic services. They've come together to do team-based care to work with individuals who are currently in the transitional housing program to both identify what their needs are so that we have a good sense across the agency, and to help connect them with the supports and services to make the transition out of the transitional housing program. This money specifically goes to backfill the Vermont Chronic Care Initiative in order for them to put forward the nurses and complex care managers there to help connect individuals with their health care, mental health, and substance use needs. In addition to that, the consensus forecast was updated. And in this case, we are at, there's about a $4.5 million gross pressure, or a $17.9 million GF pressure. This is directly related to an increase in both caseload and utilization of our Medicaid program. You see this is also directly linked to the public health emergency and the fact that we have suspended redeterminations during the COVID for Medicaid recipients. Moving forward, in 2021, we have a pressure of $7.1 million gross, or $2.7 million general fund. which is the settlement that we do on an annual basis with the ACO. Every year we agree upon a price for healthcare services. At the end of the year, we settle up to that price. And in this year's, we are providing those funds of $7.1 million to OneCare. Next up, we have the Brattleboro Retreat. Over the last year, the Agency of Human Services has spent a significant amount of time working with the Brattleboro Retreat in order to stabilize them as an organization. This started several years ago when we identified the service line items that they had that they were losing money, identified what Vermont's needs were, shut down some of those service line items. Their board chose to do that, they were losing money, and then kept those service line items that were in need of Vermont. This year, with a change of leadership, the agency was able to sit down at the table with them, go through their books, and identify where we were not meeting their costs with Medicaid reimbursement. So significantly increased reimbursement rates in order to get them to a point of sustainability. We did that after not just looking at their costs, but looking at the costs for the Vermont Psychiatric Hospital and several of the other psychiatric hospitals in Vermont, and brought them in line. Moving forward for the Department for Mental Health, as many of you know, we have had significant pressures in our healthcare system with staffing, and so as such, the Vermont Psychiatric Hospital has not been spared, and so you see $11.3 million gross, or $10.5 million general fund, in order to cover the cost of traveling nurses so that we can keep beds there open and keep individuals moving through our healthcare system. We have
Can I ask a question?
Yeah, please do.
What is the long-range plan
For-
to replace traveling nurses, which is fairly expensive, but if we're gonna spend 11.3 million extra, then, or whatever the extra is, shouldn't we be expending it on people who are committed to full-time employment with the Department of Mental Health? So I've just, we went through a lot of work with the corrections department, and I say we, judiciary and this committee, and I'm wondering if there's a similar plan of retention and recruitment for DMH.
Yeah, so DMH, similar to the Department of Corrections, has a side letter to help support their permanent staff, including retention and recruitment efforts. They are working with the Department of Corrections to identify whether there are things that have been successful there, but they had already moved to 12-hour shifts and other opportunities prior to the pandemic. And so some of the leverage that Department of Correction has, we don't necessarily have at BPCH. That said, we are seeing more nurses come in, and we are beginning to see a trend in the right direction. But this is a pressure across our entire healthcare system. It's not isolated just to the Vermont Psychiatric Hospital.
So you have this report that you sent to us, which I read over the weekend. Because my life is so interesting. And there are recommendations in it and it has to do with recruitment and retention. And your recommendations are to build on that DOC effort around investing in stability, sustainability, shift, increase differentials. But your second one was to support healthcare workers, to upskill them, and to expand. So are we going to, I'm reading all these reports that have, another one was, oh, we should study something more. And it's like, it's not clear who's going to take the initiative. In other words, I think, one of the other ones that I read was around preceptors. And it was like, well, now that we've got this, where do we go with it? It wasn't clear in terms of recommendations. Will we see something back in budget? And I realize this isn't in budget adjustment, but it was like, I read it and it was like, well, now what? And so it's helpful to think about, now, for example, I looked at the one on sports gambling. and online vetting, or whatever you want to call it. And you had very clear recommendations in that, and it was like, it was actionable, you know, this department is going to do this, and these are the recommendations around policy or licensing or whatever. So I'm just wondering, we've asked you to do all this work, and how do we make sure that we build on it? And how we're going to see recommendations that are, you know, we need more study on this, or we need to have X, Y, Z, you know, whatever. How do we ask for so many reports, and time is spent, and work groups are put together, and it's like, how do we not make sure that what's been done is abandoned or a one-off, but in fact is used as a foundation for additional work or budgetary recommendations or policy recommendations. And I know you're not, this isn't part of the BAA, but I just, those are the kind of questions that I have had, and I've been very concerned about all the reports we ask of departments and agencies, and the extent to which maybe the initiating committee is using them and picking up on them, or to try to be very sensitive about what we ask you to do, because this is no different than spending money. Asking staff time to do certain things is no different than a fiscal obligation. And so, Senator Sears, I'm sorry your question triggered that whole diatribe.
Oh, I'm glad I did, because
No, I'm also,
I'm
so,
really, I was struck by an email that all of us got from a constituent of mine about daughter was murdered.
yes, I know.
And now boyfriend of the twin to the daughter jumped out in front of a big truck and got killed in Bennington on Route 7. And the mental health crisis, and there were no beds available.
And actually, at the mental health day yesterday, Ms. Vermont,
Yeah, she was very good, wasn't she?
it was, you know, in terms of her experience with depression and self-harm and self-worth, and what she got for responses, and it was and obviously it was very, she was very articulate, she was very straightforward. It was I know you I don't know if you stayed to listen to her remarks, but it was really a very compelling case in terms of when people reach out for help, or you're not serious enough to get anything. So why don't you wait until, you know, when we go to a doctor and we say you're at risk of a heart attack, we don't say come back when you have one. And that seems to be part of what we, you know, oftentimes get for a response from systems. So anyway, we can get back to your budget adjustment, but there's a host of issues around workforce and how we're going to build, because we have to keep working on increasing capacity and supply, because all we're doing is competing for an inadequate supply. So upskilling, you may have people that have a lot of potential and with support, in fact, could move up into, you know, education and training, and they're
What
here.
did you call it?
Upskilling.
Upskilling.
It's not my term.
Yeah.
It's creating career paths.
Yeah, it's, you know, just like, you know, orientation is now onboarding. You got to get with it, Senator.
I
Sears.
see that.
Huh?
Oh, my God.
So,
They probably don't even have beanies anymore, you being a freshman.
no, they probably don't. Oh, my God.
They give those to the.
So I realize that, but I guess what I'm saying to you is, if you've given us a report and there's a recommendation or more work that needs to be done, we need, my ask of you is tell us where we go from there. Because that was kind of like a meeting that we had today. Well, here's this new fund, and it's like, well, that's good, but who do you think should administer? Who should explore it? How do we make it work? I, as a committee member, I'm a part-time person. I have no operational or administrative responsibility. So,
You ask your staff to look into it.
That's me. So I don't want the work to be lost, is I guess what I'm trying to say. People spend their time and with good faith, and we need to not make sure that it's wasted.
Chair, I really appreciate both the recognition of the reports and the burden that puts and wanting to make sure that that moves forward. I think that there's an opportunity for us to come back at some point to walk through more broadly what we're doing with workforce, whether it's the nurse preceptor program or retention and recruitment bonuses that we put directly into designated agencies and directly into other healthcare organizations across the state over the last year. And so there are quite a number of the things that are in those reports that I'm looking forward to, including with our Vermont Psychiatric Hospital, with the retention and recruitment programs that are happening there. Furthermore, I think that what I also heard was a strong commitment to the continuum of care for mental health and substance use, which I think as we come forward and present our budget proposal after we've had an opportunity to present it to the House, that you'll see that commitment from everywhere from primary care all the way up through the highest levels of crisis care, so that we recognize that particularly over the last couple of years that the pandemic has really altered the fabric of that system. It also points to the fact that our system and its designation rules are more than 20 years old. And I don't know about you, but 20 years ago, folks didn't have cell phones. And so it's really time for us to really look across that system of care and make key investments. And so you'll see that in the budget. So I do appreciate the conversation and the dialogue.
Well, I think we'll have more, particularly the areas of the agency. And I understand what you're giving for budget targets and to make them work. But I think we're obviously hearing when you're asking major parts of our service delivery system to be level funded in this budgetary environment and inflation. And at the same time, I mean, no one's coming in here saying we want to level fund state government. You figure out how to support the number of people under the existing payroll, because we're not going to give you any more money. Or we're not going to give you the 4% increase in operating costs because you're just going to have to eat it. And that's the hard part is, you know, what we're giving for salary adjustments and so forth. And that is what we're starting to hear.
And we look forward, I think you're specifically speaking to the designated agencies there.
I'm talking about services to our seniors and people with disabilities as well. I'm talking about home and community-based services providers.
So as we continue through the budget adjustment, you will also see on that note an increase to address inflationary costs for our private and medical institutions.
Oh, don't say that. Senator Sears, take a deep breath.
I'm going to actually pretend I'm not listening.
Because he has this visceral response to PNMI.
Yes, and what our PNMIs are across the state is that they provide significant amounts of residential treatment for youth, for individuals experiencing mental health across our system of care. We recognize with this group of providers that it's cost-based reimbursement. What we can clearly see, which we can't with some of our other providers, are their actual costs and the services that they provide. And so in this case and in some other cases this year, you're seeing us address the inflationary pressures for these providers. And so for PNMI providers, specifically in budget adjustment, you see $2.3 million gross or $1.1 million of general fund in order to help stabilize that system of care. For our Reach Up program, we see caseload pressure, so increased number of individuals using that program, and it's a $6.9 million general fund investment. For the Department of Corrections, I think we've already talked a little bit about what we've done for Vermont Psychiatric Hospital. For DOC, you see a staff recruitment and retention incentives. They've been working hard at looking at retention bonuses, new hire recruitment and referral bonuses, shift differential, and several other pieces in their system. And so this reflects those investments, and it also reflects a commitment to continue the evaluation of which of those is working and which are having less impact, and so continuing to move those forward. There's a $9.225 million for our inpatient psychiatric medical for adolescents. What this really is recognition that we have at this particular moment a significant need to diversify and add beds in our adolescent psychiatric hospital. And so in that sense, what we did was we put out 2 bids. This is in response to those. One of our hospitals has come forward and is currently in the process of doing a feasibility study to determine whether it's feasible to add beds at their facility. Again, it's really important in this case that we're combining medical services and psychiatric services, because we've had several groups, particularly this year and in the past, who haven't been able to get the combination of both of those in one psychiatric treatment provider.
Yes.
Is that centrally located or one end of the state or the other?
That's a great question. We only
I
have.
think he knows the answer to the
Yeah,
question.
I'm sure we do. So the only bidder that responded was the hospital in Bennington. And so that's where we're currently conducting the feasibility study. I think if another hospital came forward, it wouldn't be need to be an either or, but maybe an and both as we look at beds going forward. But again, right now we have urgent need for these beds. And so it's incumbent upon us to move forward after having had many conversations with hospitals across the state. This hospital was willing to step up and step forward. Others couldn't at this point in time. And so for this moment, it makes sense to move forward.
It's
with
quite
this.
preliminary. You haven't even done the feasibility
The
study.
feasibility study is in process and will be completed at the end of March.
So you may, I mean, if that doesn't show up well, you aren't going to do anything there, or
Depending on the results of the feasibility study, if it is not feasible to do it at SVMC, we would move forward with reproposing an RFP. Again, the challenge with that is it delays the care that our adolescents need in state now, that they're not able to get.
Are we sending any kids out of state to a very specialized mental health treatment facility?
We are sending youth out of state for very specialized mental health treatment on an ongoing basis. And so we are not able to meet the current needs of our youth here in Vermont.
And where are they?
There's a diversity of different locations depending on what their specialized needs are. An example of one of them is in Florida. And one of our youth has been, several of our youth are at that facility, but particularly one of the youth that would have benefited from these services.
that mom and dad don't go and visit that child.
Yeah, it's why it's incumbent on us to move urgently forward. And I know that for some folks that, as you said, is it centrally located? It's incumbent on us to make
Well,
sure.
Bennington's closer to
Than
Florida, Florida than Newport,
It is.
Well, yeah,
so
but, no, I'm glad Bennington showed a will, the Southwest Vermont Hospital showed a willingness to step up and do its part. One of the concerns I would have is would then have both facilities for kids in the southern part of Vermont, Brattleboro and Bennington, and you got transportation problems. But if Bennington is willing to step up and do it, I'm fine with it. I won't get into other communities, but no other community at this point expressed an interest. But I think they're still going through will it be financially viable for them to do it? And can they get the staff they need to do the 12?
The number of beds will be
But
determined by the feasibility study,
Right,
so
there's
that's,
definitely a huge need in the state for kids' psychiatric care.
So the other institution that's interested, are they also beginning a feasibility study at this point?
previously, for the first bid process, UVM Medical Center had put in a proposal. They withdrew that proposal. And so,
But they're thinking about it again. I understand that
there may be an opportunity as they were under significant financial pressures, they continue to be, and that's the reason that they pulled out of that. I think if that were to change for them, they would consider it. I think that there's also some opportunities that we're looking at because of their status as a public institution and their connection to UVM, that we may be able to contemplate additional federal funds that would be available. Again, though, that would take some time. We have an urgent need right now. It doesn't necessarily have to be an either or. You would then have a northern and a southern.
So in terms of number of beds, if Southwest Vermont goes forward with 9 beds, or is that what it was? I think. Then UVM went forward, would we be looking at additional capacity, or how will that all?
Again, I think through this feasibility studies, we will need to take a look at what would be available. And again, UVM Medical Center, we would need to have a significant amount of conversation with them about their interests.
There's a long history of discussion, but
Yes.
then in the end,
Them not following through,
yes.
correct?
So far back, I think, first remember discussions that Secretary Hogan had with, failed to materialize, so it's.
We need something to materialize now for
And if we go through the slides, it seems like what we're doing is really just a more detailed of the summary sheet, which we had. And I realize we're kind of off your script, but that's what we want to do. I know that you mentioned the House and House Appropriations Committee. They put in some last minute, fairly significant additional spending. So I'm assuming when you will have a response to us in terms of your position on that 21 million for housing. I think it started out as the vulnerable and then expanded. We do remember when they wanted to get rid of the cold weather exemption entirely. So this would eliminate the cold weather exemption well into spring and early summer.
it would extend the current transitional housing and weather event programs through the end of the fiscal year. Again, we've just received received the bill as it is, so we're evaluating it. I do want to point out some critical points about that. Right now, there are not enough hotel rooms in the state of Vermont in order to accommodate all of the individuals who are seeking services. The federal funds will expire. The availability of federal funds, the use of federal funds will expire at the point at which we have currently set the programs to expire. There will be a weather exemption that would go through the middle of April. But from the human services deep perspective, individuals who have children, individuals who have disabilities right now, with the way that the programs are currently functioning under the rules and program eligibility, and the wide open door that exists. It's a first come, first serve in the morning. So if you are a 24-year-old man and you call at 9 o'clock in the morning and there is a bed open, you get that bed. And then by the end of the day, there is not another bed available. So what that means is that an individual who has young children or an individual who has a family are not able to get into the programs. And so as such, we're not appropriately being able to prioritize the resources. What you will see is that significant amount of investments that are being made right now into building shelter capacity You'll see significant investments that are being made into bringing, which will be longer term, but are coming to fruition, permanent housing on board. And so as we contemplate our response to the House, which I don't have fully formed yet, those will be some of the characteristics for us to contemplate as we move forward. Are we serving the most vulnerable in our current programs? And are we able to, with the resources that we have? Are we wisely using the funds, the federal funds, which expire? And does our investments really get us to what we're hoping for if we extend the program forward? And lastly, hotels are not the place that people get services that help to support them to permanency. And I just want to acknowledge that up front, that living in a hotel room does not help folks make the move necessarily forward that we're hoping that they will.
I think we wouldn't argue at all. And we've seen, obviously, the impact when you have a very large concentration. And we've seen some very serious situations. But, and I don't know, I understood that the original recommendation was for the vulnerable populations to carry them through. And then at the sort of the final day, it was like, well, let everyone in. But as you're saying, that has implications and actually could make the most vulnerable more vulnerable because they end up maybe in their car or wherever they might be. So we'll await your your response on that, and I don't know whether the Health and Welfare Committee will be taking up anything on that. And then you get into that debate. I mean, some of the motels we've probably bought 5 times over with the amount of money that we've spent, and it hasn't done anything to expand supply. And so and I was talking to someone from Howard, and they actually had a building that they were going to buy that would be more housing, and couldn't get approval for the expenditure, and yet that would have been ongoing housing available. So it's like, that doesn't seem to make a whole lot of sense. We're spending millions here that doesn't add to capacity, but in terms of long-term or stable housing. And so maybe some of what we're doing could be made more strategic, but that was certainly a $7 million increase. I mean, in this environment, it seems like people's sense of money, what we used to obsess over, $1 million was a lot of money. At the last minute saying, well, let's expand and spend 7 million more, raises the question, is that where you put your first dollar? And I think that's something that those of us who sit around this table struggle with all the time. It doesn't mean that it doesn't have merit or someone doesn't benefit from it. The question is how you determine where you'd want to put that money and where you would get the longest, what is your goal and so forth. So motels are not great, but if you're there and you're vulnerable and you've got children, it's better than in your car. And so no one is saying that that's not where we would like, but in the absence of the alternative, that's better than nothing. And that's what we're struggling with right now, is how to build that supply of emergency housing. And some communities, I remember we really struggled with getting Rutland and Barry online. The communities did not want to necessarily host those programs, and now I think maybe certainly in Barry we've got, but it's full.
Barry's done better.
Yeah, Barry's done better, so we're still struggling. So and I don't know, probably the committee hasn't had a chance to know that might be it. That was one of the things that got added very, very, I think, just in the last day, and it needs to be carefully considered as we're putting
In the
it.
house, you mean?
Yeah. So Senator Bruce.
Yeah, I'm very glad to have you here because I had an email sitting in my inbox from one of the towns that I represent, and they host a motel where this population is housed. And so this person is very much in favor of providing that, but the town has had problems with people from the facility causing different sorts of problems in the area around them. And so he details those. And then at the end, he puts out a proposal. I said I would try to bring it to someone who would know something about it. Here you are. So he says, so here's a proposal. Maybe we could provide wraparound services at an increased level, but link funding for programs like these to requirements to have enforceable behavioral policies in place. That is, if they're going to continue to get state funding for their operations, they must set a set of enforceable rules and mechanisms for enforcement of civic and social responsibility, et cetera. And if the residents violate the rules, they cannot stay at the facility. And if the facility doesn't have such standards or doesn't enforce them, then they lose funding eligibility. Just wondering what your reaction to that might be, positive, negative, or indifferent.
So I want to start on the side of one of the things that you see in BAA today. The first thing is the in the transitional housing program. For many of the individuals who've been served, they've been served by a houser. And what we've recognized during the pandemic is that the housers do amazing work, but they are not able to make the connections to medical care, substance use, mental health services in an intense way. They're not able to help people navigate through getting hired and employed. Hireability Vermont is particularly skilled at doing that. They take individuals with very complex needs and support them with employment. And then we also know folks aren't fully able to navigate our economic services. So what we've done over the last, since around Thanksgiving, is really finally say, time out. How can we as an agency do a better job at wrapping around individuals at this particular moment in time where we've seen an unprecedented number of people who are experiencing homelessness. And so the agency has taken individuals from the Vermont Chronic Care Initiative, from Hireability Vermont, from economic services to do exactly that, which is to really wrap around in individuals. For those who are currently staying in the hotels, many of them, they have their contract is actually with the hotel, and the hotel has an opportunity to really make the decision about whether they continue in the program or not. If you go in the House pass, or not pass, but that came out of committee, but in the House bill that's currently proposed as a report on housing. And if you go back a year and a half, 18 months ago, there was a previous report on housing, and having sat through some of those committees and listening to them, they actually have already set forward a blueprint that demonstrates what the transition out of the housing program would look like. And it particularly prioritizes our most vulnerable. It also addresses the specific concern that you have and that this constituent has about individuals and whether we should reinstate a process where if someone is not has issues with behaviors, whether they continue to be continuously eligible for housing. And so I would really strongly recommend, rather than, as Senator Kitchell said before, reports upon reports, that we go back to what we've already done and revisit that exact question and the other questions that the House has proposed in the report that we had on housing previously.
Somehow we can solve these very complex problems by asking for another report.
Exactly. And a report was done, and that report was done with, I just want to be really, because I helped facilitate that team. It was one of the first times where the housers had to make decisions about finite resources, finite number of dollars, and finite, more importantly, finite numbers of rooms that were available. And those were hot, like, you had Vermont Legal Aid in that room, you had the housers in that room, and for the first time they were engaged, instead of just making recommendations that the agency had to, but actually in providing and coming forward with solutions. And I think it was a robust process, and I think that their recommendations were clear. And it, there were people in there whose hearts were, the Vermont legal aid attorney part was really on the table at having to finally not just make a recommendation, but actually come forward with a decision on how the resources would be allocated. So it's well thought out and it's worth going back to.
The other challenge, when you get into those judgment calls around cooperation and setting forth the plan, then you get into the whole good cause deliberations, and you can get appeals and so forth. So it really adds a very significant, I can understand why people want it, but administratively to implement it, it would take, it takes a lot of, and could still be subject to appeal. But there's no question that, communities, certainly in Rutland, I guess we've had a couple of incidents of people being murdered at motels. So it's not a good solution. And no one disagrees with that. It's just what are the alternatives and what does it take to build them and for whom? And
if I could just ask, when did the report come out? And
I'm phoning a friend a little here. My recollection is approximately 18 months ago, but COVID has kind of warped my sense of time a little bit. So my colleague Shayla Livingston is our policy director. Shayla, do you have the time, or we can send it to you? Perfect.
Thanks so much.
okay, other questions
Yeah,
around the budget adjustment or anything in particular?
yes. You said that the housing at these motels was good until the end of the fiscal year.
So right now, as it's currently funded, it's good until the end of March.
April 1st.
And April 1st. Adverse weather conditions is still in place and weather dependent until April 15th. So if for some reason, this type of weather we have today usually comes in January, and now it's almost February. If for some reason we hit April and it was incredibly cold or incredibly snowy, through April 15th, housing would be available. The House bill as proposed would extend that through the fiscal year, so through the end of July.
But after April 1st, any of the families or people that would qualify under general assistance, emergency housing could be assisted in that way.
Yeah.
So I think that's another point, is that for certain populations that have risk, and those would be families with children or people with a disability or whatever, that emergency assistance is the fallback.
But then, using the fiscal years, I thought I heard that, we're gonna be right back into winter again. And then somebody's gonna have to come up with the money to keep them in housing through the winter.
I'm sorry to interrupt, but I just want to clarify the fiscal year. By what I mean by that is June 30th. The new fiscal year starts on July 1st. So Chair, I want to emphasize something that you said, so that everyone is really clear. At the end of March, so April 1st, we default back to our general assistance housing program as it was designed. And as it was designed, it is to care for the most vulnerable. And in that case, it serves families with young children and individuals with high risk and vulnerable needs. And so I just want to, it's not at that
Everything goes
moment,
away.
at that moment, it's not that everything goes away. That safety net still exists, and our shelter programs, which have come back online and have been reinforced with funding, are still in place for individuals to be served and have housing. And so it's not, I've heard a lot of all or nothing, like it ends and nobody's going to be housed. That's not true. We still have our shelter programs, which have been reinforced, and we still have our general assistance housing program.
That's good.
And I don't know what the total is now, but at one point, maybe a year ago at least, it seems like we had paid for emergency housing motels
and rooms over $100 million. So so what has happened with the federal dollars, and because of the pandemic, benefits were put in place because we had so many federal dollars available to do it, but they're ending, and so it's just like a grant that goes away, and there's a desire, well, can the state just backfill it? And the enormity of the cost that has been necessary, and probably from a public health perspective, really has helped us as a state. But in terms of the ability for the state to sustain, the level of spending in whatever area, and people have different priorities, obviously, is just our budget is dwarfed by what those federal dollars have provided.
100 million, we could have gone and bought JP for 78 million and had 500 rooms, put people in and still own the property next year.
And we could have had an enterprise and made money from the golf course and the skiing center star.
I think your point is well made. Yeah, I think your point is well made, and it goes to Chair what you mentioned a while ago, which is as we go forward at this moment, as we contemplate what's come out as a House, we have the choice to continue to make investments that will carry forward. It's a historic moment with funding that we haven't had before. Do we do it for one-time investments that will pay for a night in a hotel? Or do we look at what the long-term investments are that really will serve Vermonters going forward? And I think that that's the question that we all have in front of us, that we have to contemplate together. And those are not like sitting at the Agency of Human Services every day where we make decisions that really impact people's lives. That's not an easy decision, but it's an important decision for us to contemplate. So I want to reinforce.
Do you have a comment?
Well, no,
I think you do.
well, no. My question is because the gap between our shelters, our general assistance program, and where we need to go, how wide is that gap?
Oh, I bet need.
You're just saying how much housing do we need?
Yes.
Yeah. Well, the housing folks say 175 million will take care of it.
Well, I'm more into how many people we're trying to.
How many people we're trying to serve. I think that right now, we're trying to quantify that. And what we're looking at is working with individuals who are currently in the housing programs and said, if this were to end today, where would you go tomorrow? And more than half of them have a plan. And so, and that plan isn't just a tent or a car. It is a plan. And so I think that we need to look at that and use that data. And that's why that's one of the other reasons why we're doing the outreach program that we're doing. It's both because I can live with myself if we didn't actually have put in place supports and services to get people in order to help them move forward, but it's also to better understand what their needs are. And so we'll be able to answer that question more clearly as we complete the initial round of surveys with folks. What I can say is that we are seeing units come online, and the historic investments that have been put in
permanent housing.
And the historic investments that have been put into that. So I don't want us to leave with this dire, we put $100 million into the housing program just for hotels. There have been significant funding put in permanent housing. And as that comes online, we're seeing many more options. So I share your concern about what that gap is.
That's not, my concern really is not, I'd like, it would be nice if we had facts.
Well, we do know the number of families. We can get that data.
But I understand that. But as you talk about plans, it's interesting to me when that information will be available to us. If in a process where I have the budget adjustment that will be here within a week, and then I've got a budget coming up, and what's the timeline whereby I'll have, and the people around this table and the people in health and welfare will have for information to be able to make a decision in a timely way. If I don't know the numbers, and, you know, I come out of it not knowing what the numbers are after.
So we do have more clarity on that, and I can provide you with some of the numbers now. And again, Shayla, yeah, can you get folks a report, and by when?
Yeah, I can work on the Shayla Livingston Agency of Human Services for the record. We can provide what we have now, and it will give you, I mean, we've done this for many of the households, not all of them, but you can see the estimates, and we can extrapolate that for you, so you can have at least a concept of what that looks like.
And that'd probably be helpful to you.
Absolutely, yeah, you're gonna send it to everyone.
I will send it over.
And again, I share your concern, and we needed to know, and we need to directly screen.
The other thing that is part of this too, and I know we need to move on to the Department of Taxes, but it's not a static population. And so, people are saying, why aren't we making better progress? We bought on, hundreds of units, and we see the numbers pretty much maybe not moving the way we'd like to, and yet we know we house and then a new entrance. So it's not like, well, you've got a fixed population, and somehow once you take care of that group, that's the end. And so that's been the other part is why aren't we, making more progress?
We've rehoused an unprecedented number of families during the pandemic. Over the first year and a half, 2 years, it was over 1,800 households that were permanently rehoused. That far exceeds any of the times that the agency has on record before that. And so I think that is an important point, is that there is, and it's not just recirculation. That's a question I get all the time. Folks are rehoused, some of the programs that are there have kept them rehoused, but we have seen an unprecedented number. I want to be respectful of your time. I do want to note one last piece, that, due to the availability of federal funds that have happened through the public health emergency, due to federal funds through FEMA, we've had significant carry forward, and there's some vacancy savings. So at this point, the agency of human services is about $50 million, so a little bit more than that, of net general fund savings that we're putting back. And
And you're
again,
putting toward your ups.
we're putting towards our ups. And I want to be clear on that. And so
The ups are covered,
Covered
and then
before
the
that.
net remaining is
50
obviously
million.
And I know that there was some controversy or some question about when you're using estimates on your child care assistance program, and on a document it said, well, that those savings were going to be directed toward the replacement to an additional juvenile facility. And we don't normally say X goes here. It's just what those collective general fund across the agency looks like. And sometimes you move it from into Department of Corrections, or so your caseloads are estimates, and reach up was too low. And so you need to put more money in. Your estimate for your child care assistance caseload was too high. But somehow by connecting it on the piece of paper, it created the concern that somehow we were doing something to take away you're shaking your head, but it was interpreted that money that would have gone to child care assistance subsidies was being redirected away from the program and being used for another purpose. And that's not how the money works in practice, but by putting on the sheet that's where the money was coming from. You could have used it in any way. You could have used general fund. You could have used the higher FMAP revenues, et cetera. So I realize the other body likes to say, I guess, connected, but it really creates the impression that somehow you may have achieved savings or made reductions very deliberately, or taken away benefits to that caseload to fund, in this case, a capital project.
And I'm only stating, and not so much for you, but for anybody who's listening, that that's not how it works in practice. It is not once those savings or those revenues are available because your estimates are off, it's fungible, and how they're used to address, it's all put together. So it's unfortunate that it created that impression. And I know that we didn't ask for it because we know that once you put the money in, it's all in one pot, that on the underspending. And then what do you have for higher spending, and how do you make it work? And so I think that there's a real challenge there, because it really is misleading in some regards.
Madam Chair, thank you for clarifying that for the record, because you are
Yes.
absolutely correct. I appreciate that.
Otherwise, I think we're ready for the tax department. It's going to